common, those spine problems and those injuries. So definitely share this feed with a friend right now if you think they need this. We're here to talk to Dr. Eris Yannopoulos from Orthopedic Surgical Partners. Thank you so much for being with us, Doctor.
Thank you for having me present here.
Yeah. What's the biggest complaint you get from people in your office?
Since I do a lot of spine surgery, most of the vast majority of complaints are back pain.
Back pain. And it's such a, I know it's actually, I think, the most common reason that people in America go to the doctor.
Actually, it's interesting you say that because other than the common cold, it's the most common reason to go to a physician.
Yeah, like back pain. And it's so common. So we're going to try and break it down so that everyone can have a little bit of education. And then if you are having a more serious problem, at least your local practice and people can come find you. So that's great too. So let's talk about exercise. A lot of people want to exercise, but they think of it more for weight loss. But you're saying exercise is really one of the most important things when it comes to treating back pain?
Absolutely. If you really want to keep your back in good shape, the vast majority of what we do in spine is non-operative. And that non-operative situation is improved upon dramatically if you exercise on a routine basis. So it's not just a matter of weight loss, it's a matter of core strength, which physical therapists, for example, will concentrate on. But what we want you to do is exercise on a daily basis. The American Cardiology Association, for example, says just for your heart, 20 to 30 minutes a day. The North American Spine Society says the same exact thing, 30 minutes a day, walking, swimming, cycling, treadmill, do whatever you can to keep yourself moving. And movement is what helps the back.
Really? Okay, so it doesn't mean that you have to go to the gym and lift tons of weight for your spine. Like walking could actually be enough exercise for the back.
Walking is great. Swimming is great. The stationary bike for people with bad knees and bad hips.
Okay.
Most good workout centers have a variety of equipment there. So my recommendation always is to join a gym, because the gym has the ability. You have the ability to change the exercise equipment. You don't get bored on one piece of equipment. But if you can't go to a gym, then walking is great. And some just light work around the house is good, just for your upper body. But a combination of weightlifting and aerobic, but aerobic being the primary.
Okay, so the success, and these are some doctor words, but I know you want to talk about them. So I'm going to let you tell me. Is it discectomy?
Discectomy.
Discectomy. What is that?
So a discectomy is an operation that we do, usually a microscopic incision, half the size of your index finger, for removal of a disc that's herniated that's causing a lot of leg pain.
Okay.
Contrary to popular belief, most back issues don't really cause that much back pain. They actually cause a lot of leg pain. And same thing in the neck. They cause a lot of arm pain because they irritate the nerve coming off the spine. So a discectomy is a removal of the piece of disc that's sitting on your nerve, that's irritating your nerve going into your leg, causing the proverbial sciatica.
Okay.
And that sciatica is a toothache going down your leg that frequently is intolerably uncomfortable. But the vast majority...
Toothache going down your leg. Okay, yeah. So that's a good way to describe it.
Exactly.
I know a lot of people suffer from sciatica.
Oh, yeah.
So is there a solution for that?
Oh, yes. The vast majority of people do better without surgery. Anti-inflammatories, exercise, physical therapy is very helpful. And if after all of that, if you don't get better, and you don't have to necessarily rest in bed, but you just have to mildly exercise and not sit too long, not sit for hours on end, and not lift anything heavy. But eventually you should get better 75 to 80% of the time without any surgery.
Okay, so that's the other thing is, I mean, you are an orthopedic surgeon.
Yes.
And some people are afraid to even call for help because they think, well, I don't want surgery.
Exactly.
So what's the first step? If you're, I mean, I had a friend, I was telling you earlier,
yeah,
who's a physician, and I know you physicians are hardy, you'll just go through anything, but he's, you know, just trying to figure out how to get through his day. If you're having back pain and you don't know what to do they call you?
Yes. Yeah, they do. And so what we do is initially we make sure that we do a neurologic exam in the office. Then after the neurologic exam, we decide as to whether or not we have the time to send them to physical therapy, to get them anti-inflammatories. The vast majority of people, as I say to you, do very well with the passage of time, physical therapy, anti-inflammatories. Where I come in as a surgeon is if after all those conservative measures you don't get any better. And then if you have a disc that's sitting on your nerve, this morning I operated on 2 different people who had exactly that problem. Disc herniations, sitting on their nerve. You take the piece of disc off the nerve, and the leg pain frequently goes away within a few days to a few weeks of the surgery.
Okay. And if you're just joining our feed right now, I just want to let everyone know that the place we're talking about is Orthopedic Surgical Partners. You're right here in Connecticut, 111141s on Cromwell Avenue in Rocky Hill, and they can reach you by going to ospct.com or 860-525-4469. So there's the information on your screen. So I think some people are like, oh, I've got this back pain, I just have to live with it, or maybe I'll just try to take some Advil. But calling Orthopedic Surgical Partners is not a rash move. You guys will start with other things.
Yes, the vast majority of the patients I see, I'll see, for example, on the average about 30 patients a day. I'll probably operate on 2 of them.
Okay, so the majority...
So the vast majority I don't touch.
So even though you're a surgeon, you have a lot of other tools in your kit.
Correct.
Okay, so let's talk about the myths surrounding mild trauma or significant injuries to the spine. So even just a little bit of a problem maybe a couple of years ago could be causing you issues?
Actually, I was going to say a little bit of the reverse. The confusion arises with mild trauma, like a mild car accident or somebody falling down the stairs, unless it's really going to involve a fracture or dislocation. If you watch your average hockey game, just watch how they play, and they very rarely complain of neck and back pain. So the neck and back are very resilient areas of God's anatomy.
They are.
Unless you really injure them badly, the vast majority of what you're feeling is muscular discomfort. So yes, it's helpful to come to us if it persists, but again, we don't rush to surgery. And in fact, the vast majority of athletes I take care of in the 95 percentile don't need any kind of surgical intervention. If they have a muscle strain, I get them to physical therapy and they get better. But I don't want people to worry that something that happened to them years ago in a mild car accident is really going to be of any consequence later on.
Okay, so that's good to know. Not that you shouldn't get treated if it happens to you, but usually we can do okay with those. So little free advice if people are like, okay, you know, there's a little added to the doctor, take 2 and call me in the morning. Like as far as anti-inflammatories, what do you recommend? I know there's Aleve, there's Advil. Like if someone is hearing this and suffering right now, what would you tell them to do first?
So the first thing I tell them to do is take a couple of Advil or 1 Aleve twice a day, 2 Advil twice a day. That's a basic anti-inflammatory. Now, a lot of people have gastrointestinal issues.
Okay.
They can ask their internist for something called Celebrex, which doesn't affect the stomach as much. And then always the question is Tylenol. And I like to combine Tylenol with Advil. Tylenol is what we call an analgesic for pain. Motrin or Aleve, which are anti-inflammatories, have a nice combined effect with Tylenol. But if you can't take the Advil, then just take the Tylenol. If you can take both, that's helpful if you're really uncomfortable.
At the same time, or you stagger?
You can take them at the same time.
Right, because one goes through the liver, one goes through the kidneys, right?
You got it exactly right.
Because even with kids with fevers, they'll tell you to alternate.
Exactly.
But I thought it was like do it 4 hours, then the next 4 hours. So no, you would take 2 Tylenol, 2 Advil all at once?
Exactly. You can take it because if you recall what happens in the hospital frequently, if you've ever been in the hospital, they'll give you the medications together. And since they're metabolized in a different area of the anatomy, they won't affect you at all.
I also think they give you 600 milligrams of ibuprofen in the hospital. So sometimes I think if it's really bad, you can take 3 Advil.
Oh, sure. You can take. I've taken 4 Advil for migraines.
Okay.
It works very well, but you just have to have a good, you have to have the stomach for it.
Okay, but you shouldn't take it more than that. Is it 4 to 6 hours?
Actually, a rheumatologist will give 800 3 times a day, but it's not something we prescribe routinely for many weeks.
Okay.
I just tell people if you really want to knock something down quickly, take 600 or 800 of Advil. I mean, that's a lot.
Yeah.
But it's worthwhile if you're really uncomfortable, along with extra strength Tylenol.
Okay, and you're not doing that for a week. You're doing that for a couple of days to just see if we can get the pain to come down.
Exactly.
Okay, so there you go. You heard it from the doctor. Okay. What about like other things? Like I tell my husband when he hurts his back that you got to make sure take the Advil, but like taking an Epsom salt bath can really help at first because of the salts, and I know a lot of football players will do that.
Well, yeah, I mean, because the significant percentage of people with back pain have back pain because of a muscular reason, not because of neurologic, not a fracture, not a dislocation, and not severe arthritis. So there's no harm in sitting in a nice jacuzzi, in a whirlpool, getting a hot shower. And some people like ice, by the way. My wife's a physical therapist. She says that sometimes people like a nice cold pack on their back. That's fine, whatever you prefer.
Is there like a way to do it that's better, like hot then ice and ice then hot, or it doesn't?
Well, that's an interesting question, and the answer is it just depends on the person. If it's a sprained ankle, like I have to take care of in football, if it's a sprained ankle, always ice. Sprained knee, always ice. You'll never see a warm compress on the side of a football field. But a back is different. A back is a muscle spasm, a muscle strain, and it's not a football injury. And very rarely, by the way, do football players ever get back pain or neck pain. But when they do, we sometimes will put a little ice on them initially. But the initial reaction usually by most people is they like warmth.
Okay. The ice can help with the swelling, but yeah, I like the warmth.
They like warmth. They like the jacuzzi.
The importance of post-operative management with physical therapy and exercise after surgery. So
yes.
I know that you said you don't always do surgery, and a lot of people aren't going to get surgery, but if you do get surgery, you're not done, right?
Honestly, that's a really important point. Whether I do arthroscopy of the knee or I do spine surgery, I really tell people that to lay in bed is the worst thing you can do after surgery. You really want to get moving. If you notice, when we do knee replacements and hip replacements, they've become same-day surgery, a lot of them.
They want you moving right away.
They want you moving. So orthopedics, our word is movement for whatever spine surgery or knee surgery or any kind of surgery you have. So yes, post-operatively, we want you to get going. Obviously, people are going to feel somewhat, under the weather after surgery, and we want you to sit and rest and lay down when you have to. But laying down for hours will do you no good.
What about supplements? I know some people have been told, if we're a lot of people around this area of the country and with our foods, we might be deficient in magnesium. And then they'll say, well, if you're having a lot of muscle spasms, make sure you're having calcium and magnesium. Or some of the more, I guess, in addition to exercise, are there things that people should be doing for prevention and just good back health?
I think that's a good question. Vitamin D, for example, is a big issue. Okay. A lot of people are vitamin D deficient.
Yep.
So especially
here.
It's true in the northeast, but the truth is that the vast majority of people, if you take a look at your primary care when they do blood work on you, have pretty normal electrolytes. But if you have a history of cramping, you should look into your sodium, your magnesium. Okay. But if you are a postmenopausal woman, vitamin D is really, really important. If you tend to be Northern European ancestry and you know there's osteoporosis in your family, vitamin D, calcium supplementation, that's really important. As far as the multivitamins, those are sometimes, according to most physicians, are overdone. But in some cases, they're necessary. But your primary care usually can tell you. Yeah, and we interview a lot of folks here, like just that are experts in supplements. But I was just curious from the actual back doctor what you recommend. But you take vitamin D do you take? I don't take vitamin D. No, I hopefully can tell. I try to get a little sun
every day. Okay, so you get it from the sun. I try to get a little
sun. Yeah, I mean, the first time the sun comes out in March, I take my shirt off to get a little extra vitamin D.
Yeah.
But
if we're not doing that,
but I see no reason why you shouldn't take a little vitamin D. No, I agree. I think it's something that is definitely a problem in the Northeast and in the North in general. Okay,
so if people need help, I think what you're saying is, number one, you can get help without surgery. So that's they got to make the phone call, and we can do that. Just if we call Orthopedic Surgical Partners, and the number is 860-525-4469.
Yes.
Or you can go online, ospct.com. Can people get in quickly? Because that's usually the problem, right? They're like, I hurt myself. What do I do?
Well, see, that's a very important point you're bringing up. We have urgent care centers at all our offices.
Okay.
We have 4 offices. 3 of those 4 offices, we have urgent care centers. You can walk in.
Just walk in?
Yeah, we have Avon, Manchester, and Rocky Hill, all urgent care orthopedic centers.
Okay.
So you can just walk in, and we will see you.
Kids too, if they come right off the soccer field or whatever?
Yes, especially kids, because we have parents that are very concerned. So one of my partners is the team physician for Rocky Hill. I'm the team physician for Simsbury. We don't even ask. They just come walking in.
They just come walking in.
I mean, if the trainer calls me up and says I have a football injury, it doesn't matter whether it's a game or it's a practice or whatever, they just walk in.
Yeah. Well, just because now people are going to wonder, especially moms, the big concern, I have a son who's going to play football in high school next year. And of course we worry not only about injuries, which you just put my mind at rest. You said spine injuries are not usually a thing football people have.
They don't.
But do we worry about concussions when it comes to the spine?
Oh, no, the spine and concussions are 2 different things, but concussions are a big issue in hockey and football, no question.
Yeah.
And in fact, it's revolutionized in some respects for the better. Helmets and the methods by which people hit each other in football. When I was a kid, unfortunately, they used to say, put your head into people. And now, I could hear from the sidelines because I was a soccer player and all my friends were football players. And it was very frightening. That has long gone away. But concussions are a concern. And we have protocols for that as well, and you come see us in orthopedics for that too. We
But you
care.
can.
Yeah, you
so
can.
if the
Because
concern might be a concussion, we still come to you.
Right, because as sports medicine specialists, we know if it's something that needs to be followed up, and then we have concussion specialists within the sports medicine arena in our hospitals.
So even if you think it might be a concussion, better just to come get screened, because you can help determine, no, it's not a concussion, or in fact it is,
Exactly.
and we need a protocol of rest.
Exactly. So, if you can't find your primary care to see you, or if you're having difficulties, you just walk in and we do our best to take care of you regardless of the injury.
Okay. Any other questions that people are always asking you that you wish you could answer for them right now?
Actually, the one question people always come up with when we're in the middle of discussing their spines is an MRI, and I just want to explain to people that an MRI is not an essential. I should know what you have as far as the disease pattern, as far as the nerve injury, even before I get an MRI. And MRIs are not going to change the diagnosis unless, God forbid, it's a tumor. So the only time an MRI supersedes my examination and your history is when you have a tumor, which is often silent. But in spine surgery, frequently you'll see that there's what they call a 40% false positive rate in MRI. So if a physician goes to the MRI first before he examines you or she examines you, you got the wrong physician. They need to examine you first, talk to you, and then look at the MRI. And frequently you don't even need an MRI. It's an overdone test that sometimes people concentrate on too much and get unnecessary surgery, get unnecessary treatments for something that really is not significant clinically.
Okay, so not that MRIs are bad, but you're saying you don't have, that shouldn't be the first thing.
Exactly. People have this unfortunate concept that that's the first thing we need to get, and the answer is no. The first thing you need to do is examine the patient, listen to the patient, get a good history, and then take an x-ray. That's usually a necessity. Get an x-ray, but the MRI is not going to change my treatment plan 9 out of 10 times.
Okay, so but the reason to go, and at first, if you're listening to this and your back's hurting and you're trying to go to work and it's not working, whether you're a kid or an adult or whatever, the first thing is take those anti-inflammatories.
Anti-inflammatories, exercise, get off the chair, get out of the chair, don't sit by the computer.
So don't just take them and lay down.
Yeah, don't sit there. You can lay down and take it easy for a little bit, but don't have the concept of laying down for hours on end. And please, whatever you do, don't sit for hours by the laptop. It's not going to help your back. So if we had access, for example, to a nice pool, I'd have you in the pool, walking the pool. If you can't walk very well because your leg is hurting too much, get on a stationary bike. But mild exercise
will heal it.
Will heal most of it, along with the anti-inflammatory. And then obviously, if you're not getting any better, you come to see us.
Okay, because the exercise, I just want to know for the mechanism, people go, that doesn't make sense because it hurts or moving. You're increasing blood flow, so your body is healing?
Precisely.
Okay.
That's exactly what you're doing.
There's an acupuncture, let's say, where there is flow, there is no pain, and where there is pain, there is no flow. So you want blood flow in that area.
Exactly.
So gentle stretching, foam rolling, exercise, that's not going to hurt you. That's better.
Exactly. So you take it easy, you put your legs up, you rest a little bit, but the concept of staying in bed for hours on end is not a great one. It's not going to help. So you gently get out of bed and try to move as much as you can. Obviously, if you're in that much distress and that much discomfort, you come see us or go to the emergency room. But for the vast majority of people, just a little bit of sort of taking a deep breath and getting out of bed and start moving a little bit is going to help.
Okay. Thank you, doctor.
Thank you very much.
And so you've learned a lot. Definitely share this. I know so many people are struggling with back pain, so it's really easy. That's what I love about Facebook Live. People can share this in their feeds and let people know. And locally here, right here in our state, you can visit the doctor. We'll put the information on the screen one more time, and you can give a call there. And we can. You were just listening to Dr. Eris Yannopoulos. You can ask for him, or he's got his team members right at Orthopedic Surgical Partners, and the number is there on your screen, 860-525-4461, right in Cromwell Avenue in Rocky Hill, ospct.com. All right, thank you, doctor.
Thank you very much. Really appreciate it.
Have a good day, everyone. I hope you feel better.